we are friends. Okay.
So Dr. Vidya Ramaswamy is a national legend in terms of entrustable professional activities. Has done a lot of the first papers, won the first grants on EPAs in dentistry. So Vidya, why are EPAs important? Why should dental schools think about moving from competencies to EPAs?
So why EPAs? That's a very good question. People might say, okay, we have competency frameworks already. Why are we moving towards EPAs? I think the fundamental reason why I like the EPA framework is because it asks a very core question that's important to all healthcare professionals. In our case, the question would be, what are the core activities that a dental professional needs to perform on graduation? And so when we ask this question, there are three important elements that are embedded in this question. One, it is the assumption that we are measuring an activity, not a competency. And this activity basically brings together multiple competencies together. For instance, what you need for treatment planning. You need, critical thinking, you need EBD, as well as clinical skills, right? And so we are not measuring these individually, but we are measuring the activity of treatment planning itself. Second, when you talk EPAs, you're talking level of supervision. We want to measure the capacity to do these activities or the ability to execute these activities at a level of supervision which can be identified as totally independent with no support. And three, an important core value to EPAs is a very rigorous assessment of professionalism, which is basically referring to traits like agency, humility, integrity. And we want to make sure that when the treatment planning activity, for example, is executed, these traits are also manifested in how the graduating dentist performs this activity. So embedded in all this is a rationale that ensuring that these three are taken care of prepares the graduating dentist for a workplace setting where patient care is the ultimate value and safe patient care is guaranteed. Finally, I leave you with a question. Think about your graduating class of dentists and think about who you would actually trust. Would you trust a loved one to go to all of them? Let's say, in the future when your loved one needs some dental treatment, are there only some of them you would trust, or is it most of them? The answer to this question is why we need EPAs.